Welcome back to SWGA Sickle Cell Awareness YouTube channel. I'm patient advocate Monica, but before we get started with today's video, make sure you subscribe and hit the notification bell for weekly uploads on Tuesdays and Thursdays. I'm super excited about today's video because I'm going to be talking about World Sickle Cell Day. The first thing I'm going to give you is the history of World Sickle Cell Day. Then I'm going to give you a summary of the United Nations resolution for World Sickle Cell Day. And then I'm going to conclude with the World Health Organization's commitment to World Sickle Cell Day. Let's get started by defining what sickle cell disease is. Sickle cell disease is an inherited blood disorder. Healthy red blood cells are round and they move through small blood vessels to carry oxygen to all parts of the body. With sickle cell disease, the red blood cells become hard, sticky, and crescent-shaped. Sickle cells die early, which causes a shortage of red blood cells. Also, when they travel through small blood vessels, they get stuck and clog the blood flow. This causes sickle cell pain crisis. The history of World Sickle Cell Day. Through advocacy of the Sickle Cell Disease International Organization, the support of the Republic of Congo and the Republic of Senegal, and the commitment in the scientific world, the African Union in 2005, the United Nations Educational, Scientific, and Cultural Organization in 2005, the World Health Organization in 2006, and the United Nations in 2008, recognized sickle cell disease as a public health priority. The 19th of June has been chosen to celebrate every year the World Sickle Cell Day in order to raise awareness of the disease in the world. Important frameworks for cooperation and partnership, these recognitions should lead to more concrete actions and are to be supported by strengthened and partnerships at national, regional, and international levels. Sickle cell disease is the most frequent genetic disease worldwide. It is present on 4 continents: in sub-Saharan Africa and in Maghreb, in Asia, Middle East, Arabic Peninsula, India, in the Americas. On the north is United States of America, in the center, Guatemala and the Caribbean islands, and on the south, Brazil, Suriname, and Guyana, in southern Europe, southern Italy, and Sicily, Greece, and Turkey. It is estimated that 500,000 are born every year with this severe and invalidating condition, and that 50% of them will die before the age of 5 years old. Transcontinental SCD is also trans-ethnic, and efforts that Black populations from African origins and Arabic, Indian, and Caucasian populations from Southern Europe. A summary of the United Nations resolution for World Sickle Cell Day. Recognizing that sickle cell anemia is one of the world's foremost genetic diseases, that it has severe physical, psychological, and social consequences for those affected and their families, and that in its homozygote form, it is one of the most lethal genetic diseases. Aware of the need for greater international cooperation, including through partnerships to facilitate access to education, management, surveillance, and treatment for sickle cell anemia. Recognizing that proper management of sickle cell anemia will contribute to an appreciable decrease in mortality from malaria and in the risk of HIV infections. Recognizing that education, information, and communication technologies play a crucial role in preventing sickle cell anemia, and there is an urgent need to create effective research and training programs in the countries most affected by this disease. The World Health Organization has started work to promote a worldwide agenda to address hemoglobin dysfunctions. WHO has made a commitment to recognize that SCD is a major health issue. Increase awareness of the world community regarding SCD. Eliminate harmful and wrong prejudice associated with SCD. Urges member countries where SCD is a public health problem to establish health programs at the national level and operate specialized centers for SCD and facilitate access to treatment. Promote satisfactory access to medical services to people affected with SCD. Provide technical support to all countries to prevent and manage SCD. Provide and help research to improve the lives of people affected with SCD. The World Sickle Cell Day is celebrated across the globe with special emphasis in African nations and Asia. The celebration includes a press, media campaigns, music shows, cultural activities, and talk shows. The main emphasis is hence on educating medical professionals, caregivers, and associated personnel about prevention, research, and resources to minimize complications due to sickle cell disease. Hence, June 19th is devoted mainly to spread awareness through talks, seminars, pamphlets, literature, and consultation. Thank you for watching. Stay hydrated and stay well. Goodbye.